Hi, I'm Jim Berkland, editor of McKnight's Long-Term Care News. I'm here with Bruce Yarwood, CEO of American Healthcare Association, at the group's 60th annual meeting here in Chicago. Bruce, you've been in this business a long time, and these are tough times?
Very tough. In fact, I think what I told the group this morning was that I feel it's a tsunami, and I've never seen such tough times. Excuse me. When we list out all the specific issues just since December, from 5-star to arbitration to card check to Medicaid to Medicare to reform back to Medicaid, and without even getting into a whole bunch of stuff we deal with day to day, this is a pretty tough time. Tough time.
And I was going to ask, it started somewhat with 5-star last December. Now, you have a few stark views about that. Well, I'll let you explain.
I have a very stark view, probably, which I won't let you quote on this sort of thing, but I think that is an unfair system to judge us on. We're all for transparency, all for doing the right thing, but it's a system that does not compare state to state. It's a system that is force-fed as to what star you can be. In other words, they'll only allow 10% of the group 5 stars, and it's a system that has nothing in it for patient or resident satisfaction. And so when we take a look at it, we just got to say this is bad. And when you know on the street that those stars are not right, just because you know your clientele, we think it should be put into a moratorium and let us kind of work our way through it.
Certainly you want to see some reform there, and I know some efforts are ongoing. But as for healthcare reform, that's in the news, but long-term care reform, you have a view on how and when that'll happen?
Yeah, I do. I think that the healthcare reform right now is getting a lot of conversation, a lot of talk, but long-term care is not a piece of that, with the exception of being to pay for it. And another exception might be in the longer term when we talk about things such as bundling. It could be that we should be looking at bundling post-acute service and paying for it differently. We think it ought to be paid by diagnosis, not by site. And when that happens, then we will be able to save a lot of money. In the meantime, I think that the crisis in Medicaid is going to force a different look at long-term care. And I say that because we are about 25 or 30% of Medicaid dollars in each state. And what I'm looking at right now is with the recession period, is that we have an increase in eligibles because they're out of work, and a decrease in revenue because the tax base is less. So now all of a sudden you got a crunch. What happens when you get a crunch? They come after our rates. When that happens, and there's only 3 places you can go in Medicaid: eligibles, benefits, or rates. And so what we have now is I think 26 states, and there's another couple out, but 26 states have either been flat or cut this year. When you move to next year, with the recession, I don't see coming off that fast, at least in terms of ours, and state governments don't catch up for a couple of years. I see even a tougher time. And then the critical thing that's going to happen, at least in the current law, is that on 1/1/11, the 8% money that was sent to the states to increase the federal match through the stimulus package goes away.
Okay.
So,
that's interesting. You're talking about looking ahead even next year. I neglected to mention that I'm sitting next to the 25th most influential person in healthcare by a certain recent poll, and that's not to take too lightly. But you're looking ahead at next year, and by all accounts, beyond your membership, you've done a great job. What can you tell us about your future? You have 1 more year in your contract.
Who knows what my future is? I have 1 more year in my contract, and we'll just kind of see what happens from there.
Okay, great.
Okay, but thanks for the question.
Well, thank you very much, Bruce.
My pleasure.